Hi, I'm Shruti. I'm Swathi, and we are the co-chairs of the political advocacy team at SNaHP. To all our fellow fourth years out there, we just want to say we made it. All the blood, sweat, and tears we poured into the past few years have finally led us to this beautiful moment. For some of us, quite literally, blood, sweat, and tears. While the next few years will undoubtedly be challenging, we can't afford to put our advocacy on pause. If anything, residency is where our voices become even more powerful. We'll be on the front lines of the healthcare system, seeing its failures up close, fighting for our patients in real time, and experiencing firsthand the barriers that keep people from getting the care they need when they need it. But here's the thing, we don't have to fight alone. PNHP and SNaHP have given us a community of people who believe healthcare is a human right. And that work doesn't stop at graduation. Whether it's organizing within our residency programs, testifying for legislation, or simply staying connected to this movement, we can continue to be a part of something bigger than ourselves. So as we step into this next phase of our careers, let's not just be great physicians. Let's be the kind of physicians who push for a system that works for everyone. Residency will be tough, but advocacy is how we keep our purpose alive. So, sign the pledge, and let's keep going.
This is Michael Massey, fourth year medical student, matching in family medicine, recording from Everest Base Camp here, wanting to talk to you all as graduating fourth year medical students and matching this just past couple of weeks or so, and congratulate all of you into matching and completing another big part of your medical school process. Wanted to talk to you all about the PNHP and SNaHP Match Day Pledge. Basically, what this is asking for all of our SNaHP students or new medical students that want to join PNHP, ask that you, as you match, kind of pledge to join up into PNHP as you join your residency. I know I'll be doing that just because it's a great group of physicians and students like-minded wanting to pursue Medicare for all or single-payer healthcare. But yeah, let's see if I can show you a little bit better view. It's very cloudy, but that's part of Everest over there. So best of luck and congratulations again. You all did incredible work to get here. Now I hope you join me in signing the Match Day Pledge. Thank you.
My name is Chiamako Okonkwo. I'm a current fourth year medical student applying into internal medicine this year, and I'm also a member of the SNaHP Inclusivity and Outreach National Committee. I'm asking each and every one of you to join me in signing the SNaHP PNHP Match Day Pledge. This is a commitment, especially from our fellow fourth year medical students, that as we become resident doctors, we also sign up to become PNHP members. This is important to me because back when I was a college sophomore in 2019, I recognized just how unique of a community SNaHP is. SNaHP is a place through which I was able to rally alongside my peers about healthcare equity and learn so much more about single payer and how to be an advocate for my patients. And I want to take that same commitment into residency with me. I'm asking each of you to do the same. As I extend my congratulations to everyone on matching, I also want to share my excitement for having all of you as my future colleagues, but also how I'm even more excited for all of you to become future fellow PNHP members. Sign the pledge.
Hello, my name is Elmfrida Olsen and I'm on the PNHP board. Congratulations on matching. Now, I'm sure you know residency is hard. You will constantly feel like you don't know anything, don't have time, and cannot make it one more day. Taking care of patients in our broken healthcare system is challenging and tiring, and some days you will question if you're really making a difference. At times like those, I recommend you come back to the fight for single payer. In my prior training in surgery, I thought the surest way out was to keep my head down and try to make it through. However, anytime I could read a PNHP email, send automatic letters to my congressional members, or listen to an activist call, I was reminded of the bigger battle we face and my passion advocating for single-payer system. Staying marginally involved in PNHP allowed me to pop my head out of the residency haze and think about the big picture, the long term, and helped me realize my true path was in preventive medicine and public health. So get to know your local chapter or stay in the loop with national activities so you can continue to help your patients outside of the hospital. I cannot wait to see what you will achieve and encourage you to consider joining the PNHP board, our committees, or interest groups to stay engaged. Enjoy the rest of your fourth year.
My name is Zach Pellis. I'm an internal medicine resident in my second year at the University of Chicago. Congrats on matching. This is such a huge accomplishment and one you've worked really, really hard for. I want to talk about staying involved with PNHP as a resident. With these new time constraints, it's certainly a challenge, but I found that when I get frustrated working in this healthcare system, my work with PNHP is an outlet for me to really feel like I'm still making a difference. I hope as you move forward into this new step, you'll stay invested, stay connected, and when you do get the chance, please continue to join us in this fight to get healthcare for everyone in this country. Thank you and congrats.
Hello, everyone. My name is Ashley Duyan, and I am a gynecologic oncology fellow here in Buffalo, New York. And I'm also one of your PNHP National Board members. I wanted to take a moment to send you a huge congratulations on making it to this point in your medical career. Myself and all of us here at PNHP are so proud of the hard work you've done to get to this point. I also wanted to take a second to ask you to commit to signing our Match Day Pledge. Residency can be an incredibly difficult and long road, and it often leaves you with very little free time to yourself. I personally chose during my own residency to try and spend some of that time staying as involved as possible with our organizing work at PNHP. I found that staying committed and connected with our cause for universal healthcare helped me feel more fulfilled and engaged with what I was doing on the day-to-day basis on the clinical side. That all being said, don't be too hard on yourself. As long as you're doing the very best you can for the people you're taking care of, everything else will follow. Congratulations again, and I hope to see a lot of you in our House Staff Member Interest Group as you transition into your residency years.
Dr. Monica Maloof, I'm one of your PNHP leaders. I am co-chair of the Illinois chapter, and I'm one of the national board members as well. I just wanted to say that I'm super excited and proud of you all as you start the match season and approach match day. I'm also faculty at Loyola Medical School, so I know all the excitement, all the emotions that have gone into this process for all of you, and I'm just really proud of you because I know what it takes to be a student, to go through the match process, and to also be a leader in an advocacy organization. As you guys proceed on this journey, I just want to remind you that this is the beginning. I know it feels like match day is the culmination of something, which it is, but it's also the start of something new and exciting, and that is the rest of your careers in medicine. And as I hope that as you embark on this journey, you'll remember all of the things that brought you to medical school. And I'm sure those things included taking care of patients and taking care of your communities and advocating for a better system. So I hope you take that energy with you as you proceed through residency and your careers. Good luck, congratulations. I know you're all going to go on to do amazing and wonderful things, and circle back with us when you're ready to keep changing.
Dr. Williger. I am calling from Atlanta, Georgia, where I serve as the chair for the Georgia chapter of PNHP. I also sit on the PNHP board of directors. I'm calling today to wish you congratulations for matching into the residency of your dreams, and just to tell you how excited I am as you embark on this next stage in your career. I also want to remind you to stay involved with PNHP. Your work with us doesn't end now that you're no longer a SNaP member, and actually I think that you will find that you want to get more involved than ever. You're going to see firsthand what it means to work in a system that really is not set up for providers or for patients, but rather for insurance companies and corporations. And you're going to want to fight back. And that's what PNHP is all about. I found my people in PNHP, people who shared my values, people who shared my passion, and people who are advocating for the things that I believe in. And I think each and every one of you is going to want to find those people during your residency. So stay with us, bring others into the fold. You're going to make a lot of new friends during residency, bring them into PNHP, and stay involved. During your ICU months, there may be periods where you can't do as much as you want. That's all right. Come right on back when you have a little bit more free time. We'll be there. Once again, we're so excited for you all. We can't wait to continue this.
Hi, everyone. My name is Sanjeev Sriram. I'm a pediatrician in Maryland and an at-large board member for PNHP. Just want to say congratulations. So proud of what you've accomplished with graduating medical school and as you embark on residency and with the rest of your careers. If you can take a minute and just sign that PNHP Match Day pledge, would really appreciate it. It would mean so much as you embark on this journey of becoming a great physician and a great champion for your patients. I want you to know that though times are going to be tough between residency and our current political climate, you will always, always have a home with PNHP. Together, we can make a difference. Together, we can be champions for our patients, and we can show them the dignity and respect and love they deserve and build a better future together. So yeah, sign that Match Day pledge and let's keep it going. Congratulations.